Welcome back. I'm really excited to do a second live stream today. I'm so sorry that my room is kind of dark. I've had to go in the back room because my nephew does homeschooling, as I'm sure a lot of people's kids are doing right now. And I'll try to get a little more light. But we have a really awesome guest today, Kathryn Pewenofkit Briner, and she'll probably correct me on that again because I botched it up. But I'll introduce her background. But before I do that, I kind of want to share some resources that I was going to talk to Stephanie about in the last video she did a couple hours ago. In her podcast that she did online, and you can look it up, she did a podcast with a flute podcast, and at the end she kind of brought up some resources that people can kind of read to get a little more interested in neurology if they want to learn a little more. And in that podcast, she brought up The Brain That Changes Itself by Norman Doidge. And I really love him because he's written a couple of books that are really great. And I read the other book that he wrote, The Brain's Way of Healing. Again, The Brain's Way of Healing is a really great book about kind of recoveries and on the frontier of neuroplasticity. And then also another resource is Oliver Sacks. He's kind of a really well-known author as well. And if you are interested in neurology or learning more about it, he writes a great deal of books that are wonderful. Musicophilia is a really well-known book, and you can literally go and buy it at Barnes & Noble. It's on the shelf usually. He also writes Migraine and The Man Who Mistook His Wife for a Hat, Awakenings, Hallucinations, and The Mind's Eye. And they're all really great reads. So I really encourage just going and picking up some of those books to get a little more aware of neurology and understanding kind of what different people deal with as far as different disorders. So I'm going to go ahead and have Kathryn come in here in a second, but I want to kind of explain a little bit about generalized dystonia, because it's not something that we really get to talk about as musicians, even as musicians with dystonia, because it's a little bit different distinction. Generalized dystonia, and I'm just going to read this from a website, so I hope that it comes across. Generalized dystonia can be inherited or caused by genetic factors. It can also be idiopathic, where there's no identifiable cause, or it can be acquired where there's a cause such as another medical condition, drugs, or stroke. And generalized dystonia is sometimes caused by a mutation in the DYT1 gene. If someone inherits this mutation, there's a 30% chance they will develop DYT1 dystonia. If a carrier reaches the age of 30 without developing dystonia, there's a good chance that the dystonia will never develop. And testing for DYT1 is technically easy. There's also a number of other genes which cause primarily early onset generalized dystonia, including DYT5 gene. And I know a lot of you are like, whoa, what's all that? So just kind of briefly discussing that. And it's a rare form of dystonia that is usually early onset. Most often appears in late childhood or early teens. And typically the condition starts in a limb and then generalizes to other areas. Involuntary spasms can occur in the foot or leg and then progress to include other limbs and the trunk, and in most cases can just progress and stabilize with a 5-year period, within a 5-year period. Cases of generalized dystonia starting after the mid-20s are unusual, and it's typical of dystonia to have muscle spasms with or without pain, twisted postures of the limbs or trunk, abnormal fixed postures of the limbs or trunk, turning in of the foot and or leg and or arm, rapid jerking movements, unusual walking with bending and twisting of the torso. So all of this is about generalized dystonia, and we're going to go ahead and talk to Kathryn about it, her experience with this as well. So I'm going to go ahead and bring her in now. So let's see here, and if anybody has any questions at any time, go ahead and post in the comments, and we'd love to have you join us. All right. Hi, Kathryn.
Hi. Metaplay. And this backwards thing kind of, I'm like, where are my bangs? Oh, there they are. Sorry.
That's okay. I feel like I have a bad hair day every single time I come up here. Luckily, it's dark today. I'm like, oh, I can hide my face. But so, Kathryn, can you pronounce your name for me again? I'm so sorry.
My family name is Pewenofkit.
Awesome. And we share kind of similarity because I think we both have lived in Colorado at one point or another. Is that true?
Well, I was there for a couple summers for Aspen Music Festival, so yes.
Okay. I think I remember one time you wrote to me when you were in Colorado and I wasn't sure. I was like, oh, I thought she lived here, but I wasn't sure.
That was actually, I think that was during a field trip, like a field work trip. So yeah.
Oh, awesome. And I'm just so proud of you for not only everything you've been through, but your educational background. You've been through so much and you've gone in so many fields and you're just amazing. Like and especially studying with linguistics as well.
Well, thank you.
So can you kind of share a little bit about your background in music? What got you into French horn playing? Did you start on another instrument? Kind of just what really got you into music?
Sure. So it actually was a surprise that I went into band in 6th grade. So I had been in children's choir and stuff at church. And then in 5th grade in Texas, they made you take a general music knowledge test before you chose band or choir. And then your score, this is the silliest thing in Texas too, right? The score on that test actually determines what instruments you can play.
Oh my gosh.
Like if you score above a certain threshold, they want you to play horn, bassoon, what was the other instrument? Oboe. So I went in for this test. We did the standardized test, right? And then we went in to try out instruments. And so I wanted to play the flute.
Oh.
I was set on playing the flute, and I wasn't even able to try the flute because of the score on that music test.
Oh my gosh.
Yeah. So Mr. Allen, he was my 6th grade band director and ended up being my college band director too, which is kind of funny. He let me try buzzing on a mouthpiece for horn. I think as well tried out the bassoon reed. And I was like, no, that's not for me. I'll try the horn, I guess. But I was so angry that like the whole first half of 6th grade, because I wanted to play flute. And now I look back on it and of course I'm like, I'm so glad I didn't play the flute. I fell in love with the horn.
Oh my gosh. That's so funny because the last live stream, Stephanie was saying that they're kind of telling her that she would be a good horn player. And she was like, no, I want to play flute. Yeah. I tell her, I said, this is so common. I feel like band directors look at our embouchure setup and they're like, oh, you'd be good at flute or you'd be good at horn. Mm-hmm. We end up on one or the other.
Yeah. So I definitely, I was set on flute. So I mean, I played all through high school. And of course, going through a Texas program, it was pretty intense. We had 5 bands actually at my high school, 4 band directors. I ended up playing bass freshman year of high school. So I've always been very lucky in that, I've had other options once all of this dystonia stuff started. So I always had other ways to make music, whether it was piano, bass. My secondary instruments were bassoon and clarinet in college.
Oh, wow.
So I think if I hadn't had those other options, I would have freaked out, right? Mm-hmm. So I ended up at University of Michigan with Lowell Greer.
Oh, awesome.
His last 2 years there. Yeah, and he was fantastic. So I was a music major and a chemical engineering major there. And music just kept taking more and more of my time. And finally, the engineering school was like, are you going to take any more engineering classes? And I was like, well, so I'm trying to think. At that point is when Lowell Greer left UM. And there was a big kerfluffle about the new, the process for the new horn professor. And a little over half of the horn studio ended up leaving the University of Michigan. And I was one of those. So I ended up at Stephen F. Austin State University in Nacogdoches, Texas, and with Dr. Charles Gavin, who's fantastic as well. Then went on to get a master's at Florida Atlantic University in Boca Raton, studied with David Peel there, and who, of course, is the son of Jerry Peel. and both fantastic musicians. And, you know, at that point, David had noticed a couple funny things in my playing, but we were like, well, maybe it's just, you know, stress. And then went on for the DMA at that point. So I was studying at UNC Greensboro with Jack Massari. And again, it was weird because I kept getting professors who were ready to retire.
Oh no, I had the same thing happen too. I mean, that's so weird.
So you know, Jack was great. I ended up subbing a little bit in the faculty quintet. I loved it there. I loved playing there. I did a bunch of collaborative work. And so 2 years of coursework with Jack. And then he decided he needed to retire. And he said, look, I tried to make it to the end of your coursework. I just can't do it. He had been having issues with like sleep apnea and got that figured out. And then he was just still really tired. So they did a search and they hired Abigail Pack for that position. And so I've made a lot of music. I had a whole other career as a musician and then went on to linguistics as well, which I use music in surprisingly.
Wow.
So I'm trying to think. And you know that I am still able to make music in addition to doing the linguistics. I study our Comanche hymns. I work with our remaining speakers with Comanche language. So I feel really lucky in that dystonia hasn't, you know, taken away all of my ability to make music.
Yeah. Oh, that's awesome. And you went to Florida Atlantic for your doctoral, right? For the indigenous rhetorics and linguistics, right?
Yeah. So I'm finishing that up right now. I finished all the coursework. So it's so I have a DMA and now I'm getting a second doctorate at the PhD in comparative studies.
Oh my gosh. That's so crazy. I have so much respect for you because I mean, that's a lot of time and investment in studies and academically. It's like, that's amazing. Yeah. Well, I'm so glad that you have.
You know, actually.
Mm-hmm. Oh, sorry, go ahead.
Well, I was going to say, I think if I hadn't had the issues with dystonia, I probably wouldn't be doing language work now. And so there are good things that have come out of that journey. And, you know, we only have, I hate giving numbers, but there's approximately like 11 first language speakers of Comanche left. So wow. Someone needed to be doing this.
Yeah, and I don't know much about linguistics, but I grew up in North Dakota, which is of course Lakota Indian tribes, and I've had friends where they've been like, yeah, culturally it's just hard to keep up traditions and in language as well. And it's kind of sad to see go away. You know, we lose. We have as U.S. citizens, we don't really have a good grasp on culture because it's so mixed. Mm-hmm. And everything. I completely agree. It's good to keep up those things because if they go away, it's like, well, that's just it's just sad. Like it shouldn't even be an issue. But yeah.
And the power of English is just so strong that even if you do all the right things for your language, for your culture, it's just hard to fight the power of English in general. It's so strong.
Yeah. Oh my gosh. Well, I'm so proud of you and the work you're doing. That's awesome. You're making the world a better place. You're doing a lot of good things for other people. And that's really what matters. That's what counts. Can you kind of share with us a little bit about your diagnosis experience as far as being diagnosed with general dystonia and embouchure dystonia?
Yeah, and so actually the diagnosis for focal task specific embouchure dystonia came first. So I was experiencing a couple of issues during my doctorate, and like one of the moments when I said, "Oh, something is not right," I was actually in a jazz transcription class, and we were doing a bop tune, and I can't. Maybe it was Donna Lee. It was one of those really fast bop tunes, and I just could not play it. And the jazz professor was like, "Are brass instruments always like this? Like, does it sound this way?" Because even he was like, "It sounds really stilted, and something's not it's not flowing, I guess is the way that he was trying to say it, because he was a saxophonist.
Oh, wow.
And so I was like, huh. And then everybody was telling me to work with the new professor. And I don't hold any like bad feelings about Abigail Pack. But personality wise, we weren't a good fit as a student and a professor, I think. And so if I was choosing a school, I definitely would not have chosen UNCG at that point. Jack and I were a much, much better fit. And she was she's very technically oriented in terms of teaching. And for me, that's not, especially with somebody who's showing like dystonic symptoms, like that's the worst thing you can do sometimes. So I agree. She was like, we need to, like, let's think about an embouchure change. And I'm thinking, this is the last year of my doctorate.
Oh no, oh my gosh.
But everybody was saying work with her, and I was trying to accommodate like all the brass faculty at this point and just get done. And I said, okay, well, let's start slow, figure out what's going on. So she had me doing free buzzing and buzzing in a mirror, buzzing on a mouthpiece, buzzing with a visualizer. And like to this day, I can't look in a mirror and play horn.
Me too. I really struggle with the mirror as well, because I had a teacher that was really all about the right looking setup, the right looking embouchure. And it, took me years to be able to play with the mirror in front of me again, just because you have to step away from this criticism, but it's so ingrained in you that you're not doing it right.
Yeah. And it had to be a picture perfect embouchure at that point. And I was like, no, this isn't working. So I had I don't remember if it was my second or my third DMA recital. And it got to be I was having all kinds of issues, but I was making it through it at that point. I was like, all right, well, I'm just tired. I've been working too hard. And the night before the recital, I literally could not play a note.
Oh my gosh.
So my back was hurting, like to the point where it was a pulled muscle, right? Is what I thought. And I couldn't walk. I was like, we just have to cancel. I can't do this. My grandmother had flown in from Texas. So I'm like, oh my God.
Oh no.
So went and got a massage, tried to play, and I was like, okay, yeah, all right. But at that point, I did make an appointment at the movement disorder clinic at UNC Chapel Hill, because I was also lucky enough that there was another student at UNC Greensboro who had been diagnosed with focal task specific embouchure dystonia.
Oh, wow.
And I think he was diagnosed in London by Dr. Fowl.
Can I ask who it is? Or
Seth Fletcher.
Who again?
Seth Fletcher.
Yes. Oh yeah. Yep. Tuba.
Mm-hmm. Yep. Tuba and euphonium. And so he had just been diagnosed and was working on his dissertation about embouchure dystonia. And so the brass faculty kind of knew, they kind of had a heads up, especially Dr. Askew, the tuba professor, and Dr. Kohlenberg, the trombone professor. And they were the ones who were like, yeah, let's make that appointment. So I went. And it was to the point where, the doctor asked me to stick out my tongue, and I would stick out my tongue and it would go to the side.
Wow.
So I was like, what? So I would stick out my tongue and it would kind of go. And he was like, no, just stick it out straight. And I was like, it can't. I couldn't drink from water bottles if they had the same diameter as a horn mouthpiece. It would trigger it. So I would get like a little wiggle on my chin. So it was just crazy, but I just happened to get somebody who knew about embouchure dystonias at the clinic. And he was like, no, yeah, this is embouchure dystonia, focal task specific embouchure dystonia.
Oh my gosh.
So it was good to have an answer, but then, I'm in the middle of a DMA.
Yeah. And it sucks. I mean, it sucks. There's never a good time for it, but it is really kind of like, oh my gosh, I've gotten this far. Mm-hmm. What do I do? Oh gosh, I'm so sorry.
Yeah. So it was crazy. So I took some time off. I was working on the dissertation, and I still had 2 recitals left to finish. But in the meantime, I was working with Sean Copeland, who is also a doctoral student at UNC Greensboro, who works with Alexander technique and a couple other methods. And then Rachel Nikitopoulos. So Rachel,
Oh,
I
wow.
cannot recommend to people. I cannot recommend her anymore to people. She is a hornist with the North Carolina Symphony,
Oh, okay.
and she does yoga and Alexander technique.
Okay.
So I was making trips to see her at that point, and so working on alignment, using tennis balls on the floor for the back. And then at one point she was like, because I said, it's like my tongue is trying to strangle me when I play. And she was like, well, first of all, you're stressed out, so it probably is. Two, that might be part of the dystonia. And so she's like, I'm going to do something weird. Let me go wash my hands and I'll be right back. So she came back and she did like an inner cheek massage and a tongue massage. And she's like, you just need to be doing that every day. She's like, let me show you what to do. And so that helped a lot too.
Yeah, I did a similar thing too. I got myofascial release through a person who specialized in it, and they did the same thing too. It released a lot of the bulkiness on my compensating side of my face, near my joint, and I really do think it prevented me from developing TMJ, because it was when I was rehabilitating, it got so bad on that side that I was like worried. I was like, oh my gosh, and she said, yeah, you're just pushing yourself too hard to recover. And, you know, even though you're seeing improvements, you still need to remember that you have a joint back here. And I said, you know, it's crazy because you're not brought up to, or you're not trained to think about your joint, or to think about your teeth, or your, you know, just know any general type of healthcare issues surrounding that, or embouchure dystonia as well.
Exactly.
Yeah. So what happened after that then? You said you went to her, but you don't recommend her.
Oh no, I said I can't recommend her enough.
Oh, can't recommend her enough. Okay. I was like,
like anybody, if you're in the vicinity and can get to her, I would go.
Awesome. Yeah. And you did she also do Alexander technique with you as well? Excellent.
Yeah, and then we moved to Florida, and she had recommended her teacher as well, and I can't for the life of me can't remember his name. He lived in Palm Beach. So I ended up not doing that here just because of other avenues, I guess. Yoga really helped. Like yoga was the best. And when we moved back to Florida, you know, I had access to the Cleveland Clinic.
Oh, yes.
So I was driving down to, oh gosh, I can't think of the town. It's the town from Burn Notice.
Oh my gosh, I wouldn't know.
Anyway, so it was about an hour drive. But I went down there to the movement clinic at Cleveland Clinic. And that's when I actually found out that it's not just focal task specific embouchure dystonia, but it was generalized dystonia. Because I had been having problems with my hands for years, and my neck as well. I always had neck pain. And looking back on it, I can say that it probably started when between 16 and 18 years old. And so in high school is when it first started, because weird things would happen. Like in marching band, I would fall just like out of the blue. I fell off a bridge in the 4th grade. So that might've been part, I mean, there was a railing missing, but I think that my leg also was, there was a spasm at the time.
Oh my goodness.
So, you know, looking back at those, and there was a little tremor in a marching band solo and, you know, solo and ensemble. I just remember like, it felt like the bottom fell out of my playing, if that makes sense. So I was playing, what's that quartet? La Chasse? That one. And I was principal. And we went to start and I went, like, and it wasn't even a note. And I just, you know, thinking back and looking back on things with 20/20 vision, I'm like, oh, okay. So Martha was the doctor's name. I can't think of her last name at Cleveland Clinic. We started talking about all those issues, and I'd had a nerve conduction study done on my hand. because if you can see right here, those muscles, oh, backwards, there we go. Those muscles are frozen. And so that's part of the dystonia. And so, I mean, I'd had, yeah, you can see the individual muscles even. And so like the range of motion in my thumb, it used to be only like that much, but yoga, actually I can now move it almost in a circle because of yoga. And then my neck was always hurting. So there's a muscle in my neck that's the exact same way as here.
Oh, wow.
Go ahead.
That's interesting that you brought up the range of motion. I was just actually watching a video yesterday on YouTube of a neurologist that was looking at a person who had hand dystonia at their range of motion in their hand, and he'd do things like, okay, like separate your fingers here. Yeah. And you'd see the range of motions, or separate here. Now try doing this, and try doing just, you know. And so you kind of get an idea of like what their range of motion was. And I said, that's really interesting. And he was mentioning in the comments that it could be it's not in all cases of focal dystonia, but it could be a telltale sign of having dystonia. Yeah. Is testing the range of motions. And it's so weird because I feel like a lot of people don't do that enough. Yeah.
And if you notice here, like, so my hand looks pretty normal here, but if I turn to the side, these fingers don't go straight.
Wow. Oh my gosh. Wow.
So they immediately pop back. So luckily with this hand, I only use these two for bass, right? This hand is much better. It's not as affected by anything, but it seems to be mostly the right side. And I notice like even my face when I talk, this is the side that's stronger, I guess. I don't know. And so I compensate when I play horn as well because of that side being that way.
Yeah, I do too on my right side. And I'm very like you know how they say like sometimes dystonia is one-sided. And I feel like it's definitely my, my right side is compensating. My left is the one that's kind of, I lack sensory, and my lip starts to go limp on the left side. And I always wondered if I should get retested for cervical dystonia or something, because I was just speaking in the last video about how I had experience when I was 14 or 15 with neck contraction. And I went to a neurologist with my mom. She's a nurse practitioner, and he told me like it's too early to diagnose cervical dystonia because it rarely happens at this age. And they're talking about cervical dystonia, and he said, but I can give her Botox injections and see if that helps, and some physical deep tissue therapy and for a couple months and see if that gets rid of it. And it did. I didn't experience that my head kind of got stuck in a position, and I would, every time I try to turn it to the right, I get zingers down the back of my neck, like this intense pain, kind of like an electric shock. And it went away for a really long time. And then after I got embouchure dystonia, I think it was like maybe, I said 2 years before, but it was more like 3 or 4 years into rehabilitation, I started to have this neck pain again, but it's not as intense as before. It's a little bit different, but and I come across a lot of players that have embouchure dystonia that have neck pain of some severity, and it's just interesting, this cross section of experiences, and it is a little bit scary, you know, when it starts to spread to other areas.
It is. And I actually, so that muscle that's frozen, I ended up getting Botox in that muscle. And that actually helped the embouchure dystonia for a while, because I think I was really fighting that muscle that was frozen in my back.
Oh, wow.
Back and neck. So at that point, I had gone back to school and I was playing principal and finishing the DMA, right? And luckily I was able to, at that point, with Alexander technique, yoga, Botox in the neck, really slowing down and retraining, you know, I was able to do another full recital. And I think that one was the all jazz recital. Wow. And then my committee said, you have enough collaborative work, because we would do full recitals. They're like, we'll count those collaborative works so that you can be done. So I was, had they not had the experience with Seth Fletcher before me, they wouldn't have been so understanding, I think, of the issues at hand.
Wow. Yeah. And I mean, especially with Seth, it's like he did a fantastic job on his dissertation, and the case study that he did is just, I mean, I wouldn't understand. When I first got diagnosed, if I didn't come across that, I would have understood nothing about embouchure dystonia without his writing. So that's awesome that you went to the school where he was at, and that they were so, a little bit more open about it, because my teachers didn't know anything. And I luckily, my last semester, I couldn't play at all. And luckily they were like, well, we won't make you do a jury, because I had happened to do my recital the year before. I got it out of the way, but at that time I was okay, I could play, but they said, well, we won't make you do a jury, and we'll let you graduate. And all my ensembles, it's like I kind of had to beg to get put down on fourth horn on everything, or drop out of classes. And it's just a stressful thing to go through, but I'm glad that you had a more positive experience. Did you have, though, that kind of experience where some of them were like, a little bit more like, I don't know, this is something that I don't get, and, good luck.
Yeah. Well, I mean, I would say, and I don't take it with a grain of salt. And I always try to not put this risk, not put, what am I trying to say? There's no blame for Abigail Pack, but I think that that was one of the things where she was somebody who just didn't get it sometimes. And there were other people in the studio too. So I think like my relationships with other musicians changed at that time too, because people would be like, oh, I'd hear someone say, oh, they said that you're not practicing enough, or, they don't understand why you're getting a doctorate.
Yeah.
And I'd be like, well, there are things going on, and we need to understand that it's not just it's not a bad work ethic. It's not I'm not practicing enough. We need to be open to conversations about what's actually going on, and people have these preconceived notions about what dystonia is, and when they hear it in your playing, they also have those preconceived notions. And it's hard to even talk with other people, because if a musician hasn't encountered it and they haven't experienced it, they often discount it completely.
Yeah, I agree. And I'm the same with you. My professor was very similar in the sense that she's very technically focused. And I don't blame her for not understanding either. But I definitely feel like the way I was being taught at the time, just my general practice and routine and way of thinking, due to her teaching, kind of, how do I say it, like it elevated my dystonia to a different, just worse. Because like they say, if you're focusing on repetitiveness and kind of these isolated techniques, like, focusing on tonguing, or, perfecting every little detail, and doing this kind of repetitive practice where you're fixing things all the time and not so balanced on the musicality, it affects it. It really does, because I remember getting to the point where I felt like, wow, I feel like every lesson I go into, I'm just fixing things all the time, even if they're already good, like, it's like, I understand that, we're all about having to be perfect, but just repeating things over and over again, and trying to make them even more perfect. It's like, I was just ready to move on. I was like, can we move on to something else? Can we start working on something more musical based? Because I feel like it was constant. You got to fix that passage right there. Can you play it again? Okay, do it again. Well, I just want a little bit. It wasn't as clean that time, so just play it again. And then it was just, like, I feel like when you get to that level where you're able to play, I don't want to say I was a great player. Like I was fantastic. That would sound, kind of chauvinistic of me. But I think when you get to that point where you're an advanced player, especially with you, doing doctoral, you don't need to be completely focused on technique all the time.
Yeah.
It's time for you to more focus on finding that balance of finding your own voice and way of stylistic playing as well.
Yeah.
And I just feel like it made it kind of, maybe that's what triggered, my bringing out my dystonia, even if I have a predisposition to it, along with all the, several other factors that they say are involved. It just kind of is a storm.
And definitely, as you said, exacerbating it, like, because you're not focusing on the music and the big picture. And it is and then it's frustrating because you're like, I'm not even making music. Like, what the heck?
Yeah, and it is very kind of like robotic if you get stuck in this technical trap. And it's just like, Nancy Bile in her study on primates, where she induced focal dystonia in them by having them write over and over and over again and practice writing over in a very, very repetitive style. And even monkeys developed it. It's just like, well, this obviously is not a good thing to constantly be focused on repeating things over and over again. It's like, touch it and then move on. Always have a balance in your way of playing. But yeah, I agree. Can you kind of talk about a little bit about, was there anything that you found helped you with your playing after you were diagnosed? Like, what were kind of the steps you went through as far as trying to regain a little abilities or try to play again?
Well, I would say, the fact that I played other instruments was good. So, and in particular, my doctorate was also not just horn, but historical performance. So being able to get off a modern horn and, play classical horn, play hunting horn, play some trompe, corno da caccia, I think that changing to the different mouthpieces so everything wasn't the same all the time was really, really helpful. But I think that the biggest thing that helped for me personally was playing tenor horn.
Oh, wow.
So I ended up playing tenor horn in the, what do we call it? Orchid City Brass Band. It's a professional military brass band in West Palm Beach. And just the bigger mouthpiece helped, having a bigger rim. It's not as constrictive in terms of airflow as a horn, right? A little more free blowing. So even that, I think, helped. So I didn't even play my regular horn for like 2 years at that point. I was just playing tenor horn. And at that point, I was even able to play a solo with the group. I was playing a lot of first. And so when I went back to my regular horn, I'm actually playing on I used to play on a moosewood. And I still like it. It's an A28. I love it. But I ended up playing on like a really old con mouthpiece. That's the deepest cup with the biggest rim. And it's more similar to the tenor horn mouthpiece. The other thing that I did consciously was I don't play principal or third anymore. And I'll just turn down the jobs if it's principal or third. So I play a lot of second, a lot of fourth.
Me too.
So I think those things were, big decisions to make so that I could still make music. What else? Alexander technique, as I said, in yoga. And then Kenny Werner. I always feel funny recommending this, but Kenny Werner is a jazz pianist, and he has a book called Effortless Mastery. And I actually really like it. I like some of the exercises in it. It's more about mindfulness when you're playing.
Oh, that's excellent.
So it actually is a really good resource. He's a great musician. And he was having problems playing when this was his whole process of figuring out getting back to playing. And he wanted to share that with people. So I think that it's a really useful book.
Well, that's awesome. I'll have to look it up and I'll share it in the comment section afterwards for people so they can look it up. I think that'd be great. Anything that helps with the mindfulness, because that's a big part of regaining abilities, or just getting into the mindset of being able to rehabilitate. And I just want to bring up as well, I thought it was interesting you said that you played on a moose wood, because I did as well when I was in college. That was my favorite mouthpiece. I was on a RBS, I can't remember, RBS 13. It was actually a Vienna cup. Like, I didn't know it was a Vienna horn mouthpiece, but I was playing on that. I was like, no wonder the shank on it's a little shorter.
I'm
but
like, how did that fit in the horn with that shank?
Yeah, I was like, oh my gosh. And then I switched to a mega moose, so really, power through. And then when I started rehabilitating, I eventually ended up on my Farkas Deep Cup, which is like, you go back to these mouthpieces that are, people would kind of consider beginner mouthpieces, but it helps, the finding the right resistance and setup. That the easier the mouthpiece to play on, the better.
Exactly.
Yeah, and I forgot what else I was going to say. Oh yeah, I don't know if Jackie's watching. She's another horn player, and she's in the Horn Players with Focal Dystonia Facebook group. But she kind of has a similar experience to you, that she plays tenor, and she finds it helps her as well, and she can play in that lower register and stuff. And the same with Jamie, who just did a video with me yesterday. He plays trombone as well, and trumpet. I'm the opposite. Like, I can't play any tuba or trombone. My sure just can't handle it. But it's interesting because I've come across people who are like, yeah, playing a low brass instrument really helps me a lot.
Well, and I think it's funny that because I was thinking about the mouthpiece thing. There are people who just can't play on anything but their own mouthpiece, and they can't go back and forth between something. And I feel like I was getting to that way before the diagnosis too, but then going back and forth between historical horns, you don't really have a choice. You got to play with whatever works with that horn. So I think that was also a lucky break for me. And so and then going back between tenor horn and my regular horn, there's a person in the group that uses an adapter in their horn mouthpiece. First of all, you lose some of the resonance of the tenor horn when you do that. And, going back and forth, it kind of freed me up from that idea that you have to play on the same mouthpiece all the time. And it allowed for more flexibility, I think, here, which was a good thing, right? And I think that balanced embouchure, some of the exercises helped as well.
Oh, that's excellent. Can you explain that a little more? Just because I was asking Jamie too, because he just started work on the balanced embouchure, and I said, I don't know very much about it except for I do know you practice a little bit of rolling out and rolling in. But can you kind of explain in a little more detail for those that might not know the method? And I know it's originally for trumpet, developed by Jeff Smiley, and Valerie adapted it for horn.
Right. And so I would say I'm definitely not an expert on balanced embouchure, but what I found helpful about it was that roll in and roll out. So playing with a rolled out embouchure when you got the mouthpiece on, right? Playing with a rolled in. And so when I first actually started doing it, I could not do the roll out at all. Because it was so set, right? So it allowed me to figure out what those movements were here what did I need to let go of? Because I was so holding it in so tight in order to get it done. And then, so I would just play through the little book that Valerie had adapted with some of those exercises. And then actually oh shoot, I can't think of his name. I don't know if he still is the principal horn in North Carolina. Andrew. And he was at UNC.
Is it last name starts with E?
He was also at UNC Chapel Hill. Gosh, I'm terrible with names right now. But I went and had a lesson with him as well. And he had some exercises that were low horn. And being able to play those with the two different settings So it was like, I think he called the exercise who's on third. And so it was like all the alternations of 2, 3, 2, 2, 3, 2, 3, 2. So it was like basically running through fourths and fifths through the whole range of the horn from the low range. And playing those with both settings with balanced embouchure, like I was like, oh, that's how it's supposed to go. And so like to this day, I have like being able to play in that register, which was, you know, that C to G middle register was such a problem with the dystonia. And now, you know, because of doing those things with the balanced embouchure and playing roll in, roll out, playing through the whole register of the horn with both settings, and being able to flip between the two.
Oh, that's awesome.
Very technical explanation.
Well, I'm gonna have to get it myself because you know, I've been thinking about it because I kind of do a similar thing, or I did a similar thing just by experimenting. Because I always tell people when I first tried to start playing again, I was like, well, you know, number one, I have all this tension. Number two, if it's a brain signal thing, this whole setup that I'm doing, even if it looks good, it's not working. So how can I deprogram? How can I get to a state of getting back to something different? So I would just try to have a loose embouchure at first, even if it was collapsed, even my quarters collapsed while I was playing. I would just let it happen. And I would kind of be observing things. And I thought, well, what if I start doing different movements than what I'm used to doing? So I would practice kind of similar, like I would practice like extreme pucker while I was playing, then extreme roll in. Then I tried doing collapsed while playing. That usually only works in the pedal register. And then like a stretch smile and see how that worked. I would try and do like I have a different mouthpiece with me. It's huge, but I would try and do like how does it feel more on the upper lip, on the lower lip, on which side? How do I change my angle? From even adaptations of like, is it easier to play stop muted on the horn or play muted on the horn with the bell on my leg or off my leg? Just all these adaptations going through the process. And I realized the more I did that every single day, just trying to figure out what worked, it helped me to kind of reset this. And it's like you said, it's hard because it's like you have to do it like one note at a time. It's like you start on one note and then you try every little thing, and then you try to get to the next note and try every little thing. And it's just literally like building your playing back up like one little step at a time. And it's awful, but, but I feel like it works. It works.
It does. And I, you know, for me, it was always a matter, do I set in, do I set on? And I got to the point where no matter how I started, that was how I played the whole thing. Because I was really set on being Einsetzen, right? So I think it was good to see how flexible I could be in my playing during the retraining.
Yeah, exactly. You kind of have to be, and you need to be, or if you're always stuck in the same signal and pathway, it's just, you're not gonna not get anywhere. But I understand, and I'm glad that you shared that as well. For your general dystonia, did you find anything that helped you with that?
Oh gosh, so we talked about Botox. I actually ended up trying Artane.
Oh gosh.
Yeah. And while I had positive results in terms of everything I did, whether it was horn, riding, my neck, I literally could not walk up a flight of stairs because of the increased heart rate.
Oh my gosh.
And so like I would be playing high horn and think I was about to pass out. So I just couldn't take the side effect that comes with the increased heart rate. So I actually didn't take anything for years for the generalized, but again, yoga, Alexander technique, you know, I can't say enough good things about both. And now actually, it wasn't my neurologist, but my rheumatologist who recommended taking tizanidine. Although now I'm not sure if it's tizanidine or tizanidine, because every time, no matter how I say it, the other person says it the other way.
I never knew how to pronounce any of those. I'm just like, I wish there's an acronym for them. Like,
right? So I don't know how to say it because no matter what I do, it's the wrong way. But so I take 4 to 8 milligrams of tizanidine. I think that's the right way at night, and I can kind of gauge how I feel in terms of how much I need to take. So it's a antispasmodic. And people who have spasms and dystonia, they generally take it throughout the day, like every 8 hours regularly. And I can't do that because I'm very sensitive to medications. So like once, for instance, I took Flexeril and I don't remember the next 24 hours.
wow.
And so I probably take 6 milligrams at night. If I know that I've been stressed and it's been like in particular with coronavirus and what's going on, I've probably been taking 8, except that I had to ration because I didn't have a refill.
Oh my God.
But it helps. But the thing is that it doesn't actually help the dystonia, but it helps the other muscles around the dystonic muscles recover.
Oh,
So
wow.
like the muscle that's frozen in my neck isn't the muscle that hurts. It's the muscles around that are getting pulled that start to hurt. And that actually goes all the way down to like under my shoulder blades. And so it's easy for me to pull a muscle because of that. So
wow.
just taking that at night gives my body a little chance to recoup during sleep. And then I have more stamina to do other things during the day.
Oh my gosh.
So for the generalized, that's what I end up doing. And come to find out that dystonia runs in my paternal father's family. That's funny. Why did I say it that way? My paternal line in my father's family. And I didn't grow up knowing my dad, so I didn't know the family history.
Oh, wow.
But it also turns out that it's not just, it's weird. It's generalized dystonia. It's also mirror dystonia.
Oh, wow.
So have you ever heard of mirror dystonia?
No, I haven't.
Okay, so that's when your the pathways to what you're doing for the different sides of your body, it kind of, what am I trying to say? So when we talk about like focal task specific hand dystonia, sometimes people will say it's like the map is messed up and instead of going to individual fingers, it's now going to the whole hand. Mm-hmm. With the map. And so with mirror dystonia, it's like the map doesn't even know which side of the body.
Oh, wow.
So it's sending it to both.
Oh my gosh.
So it would be something like if, somebody throws a ball to a child and they say catch, they're going to try to do it with both hands because they can't differentiate the two. Well, their brain isn't differentiating the two. So I had a really hard time with piano. So like piano class, right?
Yeah.
The bane of every music major's experience in college.
So wonderful.
If you're not a pianist, right? So I was having a really, really hard time with separate hands, and it was much more than my peers. And so I was like, what the heck? And there was a funny moment in jazz band when I was playing bass and my friend Frank was playing drums and he turned to say something to me and I couldn't answer him while I was playing. So I couldn't talk and I couldn't sing when I play. And so I was like, eh. And so when we stopped, I gave him his answer. And so looking back on that and then my experience with my son, with like catching balls and stuff as he was developing, it's definitely some of the mirror dystonia as well. And we're like I think the researcher said like one of 3 families in the world where they've actually seen it run in the family like that. So my nephew has it, my sister as well. So it's definitely a family thing.
Wow. Yeah. And I don't know my family background because I was adopted.
Oh, that's right. Yeah.
And but it's interesting because I have an identical twin sister, and she's a trumpet player, but she's never had dystonia, but she's had the opposite kind of experience from me. I get plagued with all the physical ailments like ischemic colitis and gallbladder attack, and now I have fibroids and hernias and just awfulness, but and dystonia, and she's more plagued with like she has schizoaffective disorder, which is like schizophrenia, but to less it's like schizophrenia mixed with bipolar, but it's not as severe.
So there seems to be like a break between physical and mental between you two.
Yeah, exactly. But her medication that she takes, it makes her hands shaky. So when she goes to play trumpet, she gets really shaky in her hands, and she's using so much tension to hold her hands, to hold it still. So she struggles with that, but she's still an excellent player. Like, she's fantastic. It's interesting because people will say all the time, well, because your twin doesn't have it, and this is not doctors, this is like just people in general, they'll be like, well, because your twin sister doesn't have it, it's just something made up. Like, it's not something that, it's like, no, it doesn't work like that. It doesn't have to be in every individual in the family. I mean, it can run in the family, but it's not in every individual. And even though we're twins, it's not that, just because she has this psychological disorder doesn't mean I have it. I have a higher chance of having it. And the same with dystonia as well. Right. But yeah, it's interesting that you said that, that it runs in your family, and that, generalized dystonia is really rare. And I'm sure it was a relief to be diagnosed and to know what it was. And that now, it is something that runs in your family. How interesting.
Mm-hmm. And I do want to say that, I don't know how your experience has been with doctors, but I remember, like, as I said, looking back, right, I think 16, 18 is when it all stuff first started. And like, there was a TMJ issue, which I now don't think was the TMJ issue. But I went to a neurologist because of some of the issues when I was in undergrad. And, that neurologist actually looked at me and said, he's like, you're too young to be having these issues. It's all in your head. And I should be sending you to a psychiatrist.
Oh my gosh.
And I'm like, what the? And he was really the only one who was like that. But, that was pretty traumatic at the time. And it probably caused me to put off trying to find other answers.
Yeah, I definitely had a similar experience as well, but not so much with doctors, but with when I first started having symptoms, I was talking to some professors about what was happening with me, and right away they were like, Jacob's method, and singing while you're playing, and then also what's that book, the Art of Tennis Playing.
The Green book.
Yeah, by Green, and read these books and really get into the mental psychological aspect of it. And I went through all that, and I even went so far to reach out to my older sister, Holly, who is she's actually a professional psychologist. She got her doctoral degree, and now she works in child psychology. And reached out to her and said, are there some books you can lend me on just cognition and kind of like self-esteem and just all these areas that I was diving into that had no improvement. They weren't dystonia. And it was frustrating at first, because I went for about 1.5 years thinking that it was in my head, and thinking that it was something that I could just, improve, even though I had never struggled with anxiety. I never struggled with performing on stage, and I still didn't, even with the symptoms,
Yeah, it was the same.
Yeah.
It was so weird when it started happening, because people were like, oh, maybe you're just stressed, you're nervous. And I'm like, but I don't get nervous.
Yeah.
I mean, I just, no.
Yeah, even when there's moments where I crashed and burned, especially with my dystonia onset, it was a horrible experience to go through, but it didn't stop me from trying to play. I wasn't like, so embarrassed to the point that I was like, I know I'm a good player. I don't know what's going on, but I know I'm a good player. I'm not scared. But you know, it's just frustrating to go through that process. And I hear about a lot of people who have bad experiences with neurologists or doctors, and it is really hard to find those few and far between specialists that really get it, really understand it. The last video with Stephanie at the end, I kind of shared a list of neurologists in the US that are well known for working with musicians with dystonia, just so people kind of have an idea of who they can go to and not be like going through this whole process of
trying to find,
yeah, it's really important because it can take a toll on your well-being. You know, it's like, that's horrible when somebody tells you, when a doctor tells you that it's all in your head. That's even worse than hearing it from a colleague.
Yeah. And I try to remind myself, like, it was a doctor in a really small town in East Texas, so I can see where he was coming from, but wow, no.
I know, and I think the longer you have it, you realize that it's just it's beyond anyone, you know, people's comprehension who don't have it. There's so much involved. But I'm really glad that you shared your story as well. Is there anything? Well, actually, there's two questions. I was going to ask you if there's any advice you would give to horn players that, let's say you come across somebody that has embouchure dystonia or some type of dystonia on horn. What would be some advice that you would give them if they came to you and asked, like, you know, what can I do? Or is there any type of advice you can give me?
Yeah, first of all is put the horn down for a little bit and just take some time for yourself. Shorter, like whatever, and find a hobby. Like, musicians are terrible at having hobbies. Right? Find something you enjoy to do that is not music. First of all, find out who you are when you're not a musician. Because I think that's something we don't talk about a whole lot too, is that we have this idea like, I'm a musician, it's who I am. It's not what I do, it's who I am. Right?
Yeah.
You know, find something that you enjoy that is not music. I'm not saying put the horn down for a long time. I'm saying put it down for like a week. Find something, see if you like it. Shorter practice times, not longer. Just keep the horn out if you can, if you have the ability to, in a room, which I think I heard Stephanie talk about too, right? And that's what I do. I just leave my horn out, and when I feel like it, I pick it up and play for a little bit, put it down, do some other stuff, come back, try something else. So I think those are the two main things. There was something else. Oh no, it just went out of my head.
Oh no.
We were talking about advice. Oh, be patient with yourself. And that's hard to tell somebody, right? But I think that's the most important thing, is that you have to be your number one supporter. You have to get rid of that voice in your head. That's cool. And give yourself some time and space. And only you can create that time and space. So I think that would be.
Yeah, exactly. Well, it's excellent advice. I agree with all of it. And, you know, the patience thing, especially, and the space as well, because, you know, we get stuck in these situations where it's like, we get it, especially, you know, like you and me and Adam, we got it kind of in the middle of our schooling. And even at the professional level, musicians, they'll be, you know, busy with their jobs and everything. And then it's like, how do you step away to take time away from it? But I think the more we promote injury awareness and dystonia awareness, I'm hoping that someday down the road, it'll be more understood when someone's like, I got to take time off and figure this out and not lose my job and not lose, you know, not graduate because it's something that's out of my control. Yeah, I definitely agree.
And I also, you know, I wish there was I hate to call this an easy solution, like the brain surgery thing. Like, I wish we could just make it go away with embouchure dystonia. and it's just so complicated, and there's so many muscles. And I think that, again, that's, for people who have embouchure dystonia, it's even more important to have that time and space to figure it out.
Yeah, definitely. And it's culturally too, we just are stuck in this kind of like, go, 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 just keep going, keep plowing through. You never have a break period. It's like you just go, you get in college, you study, you improve, keep improving,
be productive,
trying to, push yourself to get beyond the threshold. And it's just seems like it's a never ending journey to try and be perfect. And I don't think that's healthy. But unfortunately, I feel like if we can find a way to address injuries and dystonia and find a way to find balance, maybe someday musicians will be more open to being like, well, maybe we should develop a healthier pathway to our career and not be so stuck in this one track kind of deal.
Yeah.
Well, I'm so glad to have you on. Is there anything else that you wanted to share before you go?
No, thank you so much for doing this. I wanted to do stuff like this when it was happening, but it was still so raw. It's hard to get past that rawness sometimes, I think. So I'm glad that you're doing this now, and I'm glad we're all sharing our stories to do it. So thank you.
Oh, you're welcome. I think so too. It is really hard to talk about at first because it's a lot to comprehend, and it takes, actually, I feel like for me, it took a couple years, probably about 5 years before I felt like, okay, I kind of have a grasp of understanding of this a little bit, and
I think also the grief aspect, right?
Yeah, the grieving process.
And it definitely is a process, and you have to process that before you can go on.
That's so true. And I think it's definitely, at the time we kind of go into denial, which is part of the grieving process, but we're like, we don't realize that we're going through the grieving process. I meet a lot of people that will reach out to me that will have been diagnosed or think they have it, and they're just in panic mode. Or they go straight to kind of denial, where they're like, they're like, well, I just, they'll go straight to, I can't do this because of X, Y, Z, like I can't rehabilitate because I'm too old. I do this, I do that. I can't do it. It's not even worth the effort. And then I'm like, yeah, they're definitely going through the process of grief, because I think, any musician that's loved their instrument and gone through the ropes, if you're at a healthy state of mentality and you're ready to go into rehabilitation, you're not going to be saying things like that. And it's just hard to get them to see that they are grieving, and it's an important thing to go through. It's difficult. Well, I'm just really glad to have you on here. And let me see here. I thought there was one last thing I wanted to share. Oh yeah. If there are any books that you can recommend, you can leave in the comments afterwards if you want. Or is there anything that you'd like to share now? Any resources? Any people's names?
Just the people that I mentioned. So Rachel Nikotopoulos, the Kenny Werner book. I love it. Effortless Mastery. And actually I like the Jeffrey Agrell's book, that new improvisation book that he has about sort of like making music play. I think that helps a lot too. So it's improvisation for classical musicians, right? And coming from a jazz background, of course, I love improvisation anyway. So it's a way to get playfulness back into classical music sometimes, because we're very serious bunch sometimes. And I think, was there anything else? Oh, my other advice. I just remembered what it was.
Yay.
Don't listen to bad musicians. for like a year. Don't listen. Like if you, and it's hard to say that, like if somebody's a professor, right?
Mm-hmm.
It's hard to, like when you have struggling players. So like I remember being at a I think it was the Southeast Horn Workshop. It might have been mid, what do we call it?
Midwest Horn Workshop?
Yeah, it was one of the two. Or Northeast Horn Workshop. Actually, it was Northeast Horn Workshop. Because it was when it was hosted in Delaware.
Okay.
We actually had to leave a recital because there was somebody on stage who was struggling to play. And it was a professor who I think has since been diagnosed with focal task-specific embouchure dystonia. And I did. And Rachel was like, you need to give yourself the permission to leave when it's like that. Because I was sitting in the chair and my mouth just started going like that. Gosh. And I was like, whoa, what is going on? And I had to leave. So, you know, don't listen to people who are struggling. Listen to different genres even. I think is helpful because because the way that the brain works, it's actually activating those muscles even if they're not moving. So like they did those studies with the tennis players, right? Mm-hmm. So when a tennis player watches tennis, those same synapses are firing. So give your space to like not give yourself permission to not give bad musicians space in your life for a little bit of time frame. And by bad, I don't mean like bad musicians. I just mean like teaching junior high kids when you're struggling with dystonia is probably not a good idea.
Yeah, I agree. And I feel like even when I first started playing orchestra again, it was a little bit hard for me.
If the tuning was pitchy.
Yes, because not just that, but it's like, when you're playing in a not so great group or, an amateurish mm-hmm. group, and not anything against amateur groups or local groups, but it's almost like you have to work harder to play with them because it's like you're constantly wanting to adjust to the intonation and there's no intonation. And then you constantly want to find balance in the horn section and there's no balance. Or, you're trying to constantly keep up with this dynamic and you kind of just have to let go and just be like, you know what? I don't care.
Yeah. So I would say like be a little more picky for a certain amount of time because it is, you do need to give yourself that space to not be around it to where it's triggering stuff.
Yeah, exactly. I told someone once that, if you can get to a point where you can listen to a past recording of yourself and not extremely judge it and not trigger this, you're in a good spot. You're going to get a good spot mentally to rehabilitate.
Yeah. I think that's great advice.
Yeah. And also when you said bad musicians, I right away thought, like bad musicians giving advice.
Yeah.
Nobody watched that video where the person's like, hold your face like this the whole time and your dystonia will go away. Do not watch that video. It was bad advice. Yeah. All right, Kathryn. Well, it's so great to have you on here. I'd love to have you on here again, as well as everyone else. It's just been amazing. And it's made me really feel connected with the dystonic music community. Mm-hmm. And I hope it has for you as well.
It has, definitely. So thank you again. And yeah, we should definitely do some more stuff.
Yeah, it's so great to meet you. Kathryn and I have kind of chatted back and forth a lot throughout the years on Facebook, and we just never have met. Mm-hmm. All right, Kathryn. Well, I hope you have a good day, and please stay safe.
Thank you. You too.
All right. Bye.
Bye.